Hey guys, it's Chris. I wanted to show you today how I do my injection of testosterone. And I used to do it intramuscular in my thighs, but I got a lot of scar tissue, so it started to hurt really bad. And anywhere I put it, because I would move the site all the time, but it just started getting crampy, and it started like my muscle would jump. So I started doing it in my tummy fat, so it's been a lot easier. So I'm going to show you how I do mine today. And first I put my vial in my armpit and I warm it up so it wouldn't be as thick. It thins out because it gets warmer, and it's easier to draw and inject. So my tools are, I got off of a site. I think I have a video some time ago. You can go in my videos and look, but I went through a site and I did not need a prescription, and the boxes come in a brown box with a lady's name on it. And anyway, I got a box of 100 of the tips. They're 26 gauge ½ inch because I do it in my fat, so I don't need them long. And then I got a box of the 3 ml syringe with the 22 gauge needle attached, and I'll show you what I do with that. Okay, so first I'm gonna go ahead and prep the area. I wonder if I could just lower you guys. Okay, don't fall over. Anyway, so I'm gonna prep the area. It just has to be 2 inches from your belly button, or at least. Okay, and then I get my vial that I had in my armpit, and I clean the top. Okay, now I go ahead and I open my syringe. And one thing you want to do is you want to make sure that this lid, that was super not tight. I mean super loose. So make sure you twist that, super tight, because one time I went to try to draw the testosterone and air was coming in and out. I was like, what the? So anyway, just make sure that's tight. Take the lid off. And then draw back to, you can draw back a little bit further than you dose, because you have to replace the liquid you're taking with air, or else it'll create like a vacuum, like it'll be like, and anyway, so you put it in, you put the air in, and then you start drawing. So not super quick. Around about there. So you pull it out, and then you pull back. When you pull back, it clears everything out of the needle. That way you don't waste any when you go to take this off. None is left in the needle. and I'll show you in a second. So you put the needle cap on, and then you twist that off. Make sure it's all in there, and then you set this aside. And then you get your little, your smaller gauge. Some people, they don't mind using the same needle, but I like mine to be super sharp and used for the first time. Make sure you don't touch that tip, because anything on that tip could get inside and give you an infection. Anyway, so you take this off. So yeah, see, it's just a super short needle. Well, anyway, so yeah, it's as big as like my nail. So since we pulled back, there's like no bubbles there. So just push it up and push it up. There you go. Now if you do this in the fat, if you have a little bubble, a tiny bubble or whatever, you know, it's fine. But like, I have no bubbles, no nothing. So anyway, so I'm doing it in my belly. So if you do it here, don't squeeze. Just, you know, find a place in between your hair follicles, or just search around for a place that does not have a nerve, and that's what I do sometimes. And then just put it in. And then when you put it in, you don't want to shoot. You don't want to do it fast, because if you think about it, if you have a high pressure hose and you shoot it at the ground, at dirt, what does it do? It like it like breaks away the dirt because it's super pressurized, and it just damages where the dirt is, and it just tears it up. That'll do the same thing to your cells. If you press this, just go super slow as you can, and that way you're not going to be, you know, shooting directly into the cells like really fast, because that's a very small opening, and it'll do the same to your cells as the high pressure hose does to the dirt. So just go slow and take your time. So what I do is I feel around for a spot that I don't feel a nerve at. So let's poke around here. Right there. So I just go in, maybe. Okay, that wasn't bad. So go ahead and hold the syringe and just go super slow. I don't know if I'll edit this out. But you can skip ahead in the video if you don't want to watch. Okay, so that's done. So I let it sit there for a second, and then I just pull out. A little bit of blood, not too bad. So when you're done, put the cap on this, and be careful because I went to put the cap on like this one time, and the needle is such a small gauge that it came through the side and poked my thumb. So it gave me a fright. It didn't really hurt. So, and then what you could do is take these off. So you have this, you could put this in the trash. And then just put these two little things in your sharps container. Let me show you. Sharps container. So, let's see, how many years have I been doing this? This is my original sharps container. This little thing. Let's see. It's as tall as my hand. And, you know, I just have a couple things in there. But I only have the tips. So I've been doing this since 13, 14, 15, 16, 17, 4 years. And actually I just passed my 4-year mark, May 6th. Happy birthday to me. So if you do that, it'll save room. So, yep. So all done. So yeah, I guess that's it. So just keep those little tips in mind, and I guess I'll show you my chest too. This is 11 minutes, but anyway. Okay, so this is my chest. So I gained some weight. Dr. Bluebond did do lipo. This side looks a lot better than this side because, you know, I'm a bigger guy, so I carried my weight in here and around my back and my tummy. So she did some lipo here, and that side looks really good. This side, you know, I don't know. But one thing I was concerned about was I think there's this muscle that goes straight through here, but I think you guys can, let me see that right there? Anyways, it's not on this side, and it feels like a muscle in there. I don't know, I'm gonna get it checked out, but she put my nipples exactly where they need to go, so if I were to, you know, my muscle, it goes like right there. So that's perfect, right on the nipples, right there. So, oh, and my poor tattoo. Anyway, so this is, let's see, when did I get my surgery? August of, I don't know, you'll have to watch my videos. I just forgot. Was it August of 16? So it's been almost August, September, October, November, December, January, February, March, April. So it's been almost 9 months. So, yeah, I'm loving it. I just need to get to the gym, you know? Anyways, and it just buckled a little right here, but I'm not worried about it. I love it. Choo-choo. Anyways, thanks guys for watching, and I'll be seeing you around. Bye.